An auto-diagnostic two-layered analysis of kidney disease, CKD, risk in relation to 4 biomarkers and diabetes, compared with 4 lifestyle factors, using viscoplastic energy model and neural network big data AI model, number 1230, VMT Sharp 616, March 7, 2025, by Gerald C. EclaireMD Foundation. Category, Nephrology, and Methodology. Abstract. Key message, chronic kidney disease, CKD, has 5 major influential factors and over 30 specific risk factors identified. These 5 major influential factors are diabetes, hypertension, obesity, overweight or high belly fat, cardiovascular diseases, CVD, and chronic inflammation and oxidative stress. Diet and CKD. Certain fruits and foods can support kidney health by helping detoxify and cleanse the kidneys. While the kidneys naturally detoxify the body by filtering waste and excess fluids, consuming the right foods can enhance their function and reduce the risk of kidney-related diseases. Fruits that support kidney detoxification, such as lemons and limes, cranberries, watermelon, apples, blueberries, and strawberries, pineapple, and pomegranate. Vegetables that aid kidney detox, such as leafy greens, kale, spinach, cabbage, beets, garlic, and onions, celery, and carrots. Other foods that cleanse the kidneys, such as turmeric, ginger, chia seeds, flax seeds, olive oil, green tea, ginger tea, hydration, and herbal teas, and even plain water drinking for kidney detox. It should be emphasized that avoid high sodium foods, excessive high amount of protein consumption, particularly animal protein, most of processed foods, particularly ultra-processed foods, such as hams, sausages, and artificial sweeteners if you can, as they can stress your kidneys. This CKD study, the author has selected 4 primary factors for his CKD risk studies. 1. Estimated average glucose, EAG, represents diabetes risk and long-term glucose control. 2. Fasting plasma glucose, FPG, in the early morning, indicates the health state of pancreatic beta cells. 3. Visceral fat percentage, VF%, high visceral fat levels, above 13%, contribute to internal organ damage. 4. Blood pressure, BP, hypertension damages the kidneys by narrowing and weakening blood vessels, reducing blood flow and oxygen supply, leading to glomerular damage, impaired filtration, kidney scarring, and ultimately, chronic kidney disease, CKD, and kidney failure. For a comprehensive analysis, the author should conduct 4 separate second-layer analyses, examining each of the 4 selected biomarkers against 4 selected key lifestyle factors: carbohydrate and sugar intake per meal, daily, walking steps, food portion per meal, in grams, and daily sleep duration and quality. Of course, additional lifestyle factors could be included and analyzed. However, for simplicity, he chose to focus on these 4 selected elements only. In this study, he selected EAG versus 4 lifestyle factors for his second-layer analysis. Neural network big data AI analysis. The author utilized 1. First layer's 4 biomarkers as primary independent input variables, directly affecting his CKD risk. 2. Second layer's 4 lifestyles as influencing variables, affecting his first layer factors of EAG. 3. His CKD risk probability and EAG levels are chosen as his 2 dependent output variables, using over 10 years of self-collected personal data from past 3,573 days, and applying a neural network big data-based AI model, NNM. The author successfully identified 27 outlier data points, 0.76% of his total 3,573 data points. In his CKD study, 18 outlier data points, 0.50% of his total 3,573 data points. In his EAG study, these 1.26% of 3,573 total data points, i.e. 45 outliers or troublemakers, influenced his CKD risks over the past 10-year study period, a total of 3,573 days. Outliers identified over 3,577 days. For his CKD risk, EAG, 7, diabetes, FPG, 11, insulin resistance, VF, 4, obesity, blood pressure, 5, hypertension. For his EAG analysis, carbs and sugar, managing carbs and sugar intake is crucial for both diabetes and kidney health. 6, walking steps, regular walking at a moderate pace, benefits both diabetes and kidney health. 7, food portion, affects weight, directly, and diabetes with kidney conditions indirectly. 2, sleep score, affects overall metabolism. 3, this analysis represents a micro-view approach, utilizing a neural network model, NNM. The numerical values of outliers correspond to specific dates, when events occurred. This study also highlights the importance of his continued efforts to reduce glucose levels, particularly fasting plasma glucose (FPG), in the early morning, while minimizing sugar and refined carbohydrate intake and maintaining daily walking exercise. A different perspective, viscoplastic energy model, VMT. In addition to this NNM microlevel analysis, the viscoplastic energy model, VMT, of physics and material engineering science provides a macro-level perspective on the same research subject. It presents the following results, based on the energy generated through the interaction between selected outcomes and their associated multiple input variables at each layer. CKD risk versus 4 biomarkers, relative energy contribution percent. EAG equals 22%, FPG equals 28%, VF percent equals 28%, BP equals 22%. EAG versus 4 lifestyle factors, relative energy contribution percent. Carbs and sugar equals 34%, steps, daily walking, equals 22%, food portion equals 18%, sleep, duration and quality, equals 26%. Beyond the previously identified outliers using micro-viewed NNM model, i.e. FPG, carbohydrate and sugar intake, and walking steps, this macro-viewed viscoplastic energy, VMT, method has also highlighted visceral fat and sleep conditions as additional crucial factors as well. Final remarks. This multi-layered, physics-driven energy study and AI-driven outlier study have effectively identified the key risk factors influencing the author's CKD risk. The macro-level VMT model quantifies overall energy contributions, in combination with the micro-level NNM model pinpoints high-risk outlier values and days that significantly affect his long-term kidney health picture. Based on the author's personal data, this analysis demonstrates a highly effective methodology and a practical tool for auto-diagnosis and development of a personalized treatment plan, which could utilize a smartphone's computing power for daily healthcare guidance and management. This scientific approach and auto-diagnostic tool can significantly enhance patients' health conditions on a daily basis. As a result, routine clinical tasks, especially in preventive care, can be greatly reduced. If this shift occurs, a clinic doctor's valuable time and resources can be redirected toward treating more serious and complex cases, or advancing medical research for further breakthroughs.